Hello, my people. My name is Dr. Jacob Ayodele Omodara. I'm so excited today to be speaking to you. Thank you all for coming to this event. Uh, and I'm so excited, to be giving a health talk to you people in support of my late sister-in-law's foundation, the Gbemi Akinfenwa's foundation. I'm a general practitioner in the UK. That means I see a lot of people and help them, people with high blood pressure, otherwise called hypertension. In Yoruba, we call it Arun Ifupa. And I also see lots of people with diabetes as well. Arun, Arun sugar, Arun sugar, yes, diabetes. So I have almost 25 years of experience as a doctor and almost 2 decades of that as a GP, a general practitioner. Some people, you know, call us family physicians as well. Uh, and with that level of experience, uh, I have come to realize the importance of preventative medicine, and early detection of health problems. I know many of us, we think, in Nigeria, we don't have access to heart surgery or some kind of, brain surgery. But what actually, you know, kills most people, you know, is things that can be prevented. Things, if detected early and managed properly, will not lead to problems that will require brain surgery, for example, or heart surgery. So, and of these problems, I think the two most important uh, diagnosed infections will be hypertension and diabetes. So that's why I'm so excited to be, talking about it today. And I hope, we'll be able to go home, you know, with one knowledge or the other that will change our attitude, to our own health. Before I talk about what hypertension is and what diabetes is and how people get these diseases, I would like you to watch, this short clip. Then I'll come back.
When your heart beats, it pumps blood round your body. As the blood moves, it pushes against the sides of the blood vessels. The strength of this pushing is your blood pressure. As your heart pumps, the flow of blood in your arteries and your blood pressure rises and falls in a regular wave pattern. Blood pressure is shown as two numbers. The top number, or systolic pressure, is the pressure when your heart beats. The bottom number, or diastolic pressure, is the pressure when your heart relaxes. Healthy blood vessels can stretch to allow for these changes in pressure. Damaged blood vessels are less stretchy, which increases blood pressure. Constant high blood pressure puts extra strain on your heart and blood vessels. Over time, this increases your risk of a heart attack or stroke. It can also cause problems for your eyes and kidneys. High blood pressure speeds up the process of atherosclerosis, where fatty streaks form inside the arteries. If one of these cracks, it can cause a blood clot in your arteries. This is what causes a heart attack or stroke. It's never too late to make changes to protect your heart. Think about your future, being there for your family, your plans and dreams. Could your blood pressure affect this?
As explained by the video, you could see that high blood pressure is caused by, excessive pressure in the blood vessels. That's the pipes that carry blood from the heart to the various parts of the body, like the brain, the eyes, the kidneys, the heart muscles. So if the pressure is very high in these pipes because of narrowing, because they become narrowed because of deposition of all these uh, sticky stuffs on in the lining of the blood vessels, then the heart would have to work harder because the heart is a pump. So because it's very stiff, the pipes are stiff now and narrow, the heart works excessively. And if it keeps doing that, if we have blood pressure which is not treated and the heart keeps pumping at a very high pressure for many, many years, maybe 5 years, 10 years, 20 years, of course, the heart will become tired. The heart will not be able to cope. It will become weaker and it won't be able to do the job properly. That's when the heart fails. That's what we call heart failure. The heart becomes really bigger and wider in attempt to cope, but it will just give up at some point, and that causes heart failure. That means we become really tired and breathless when we're trying to do things, to walk, to be active. We're going uphill, and when it becomes really severe, our body begins to retain fluid because we're not able to get rid of this fluid from our legs, from our lungs, which kind of make us breathless. So that's how it causes heart failure. Then it can also cause what we call chronic kidney disease. This high pressure, kind of damages the kidneys. And the kidneys, what they do is they remove toxins. We all produce toxins, after we've eaten, and the liver breaks them down, then our body releases toxins that needs to be passed out through the urine. So if the kidney is not able to do that properly, then because of damage to the kidney, then it can be quite serious. At early stage, we call it chronic kidney disease, but when it's quite severe, then the kidney can fail completely, which is called heart failure. That's the point when such people will need machine to remove these toxins from their blood, and they will need to do this if maybe a few times a week, for the rest of their lives. And these machines are not readily available in our part of the world, and where it is available, it doesn't come cheap. It can be quite expensive, as well. Then the high blood pressure can also make the blood vessel to suddenly either get blocked, which it would cause a stroke because it stops blood flow to the brain, and then that part of the brain will become dead, and that's what that we call stroke, which can kill as well, or cause us to lose ability to use part of our body like the hands and the legs, and part of our face can become quite weak, or if it doesn't cause blockage, the blood vessel can, because of that pressure, the blood vessels in the brain can actually rupture and cause a bleeding to the brain. This is another form of stroke, which is often very life-threatening and more serious. Many people often die from it. So that's why it is very important to detect this problem early and treat it. If it is treated, if we do the right thing to treat it, then it can stop all these complications from developing. Yeah, let's watch another video, then I'll come back. Thank you.
There are two main types of diabetes, type 1 and type 2. They're different conditions, but they're both serious. There are some other rarer types of diabetes too. What all types of diabetes have in common is that they cause people to have too much glucose in their blood. But we all need some glucose. It's what gives us our energy. We get glucose when our bodies break down the carbohydrates that we eat or drink, and that glucose is released into our blood. We also need a hormone called insulin. It's made by our pancreas, and it's insulin that allows the glucose in our blood to enter our cells and fuel our bodies. If you don't have diabetes, your pancreas senses when glucose has entered your bloodstream and releases the right amount of insulin so the glucose can get into your cells. But if you have diabetes, this system doesn't work. When you've got type 1 diabetes, you can't make any insulin at all. If you've got type 2 diabetes, it's a bit different. The insulin you make either can't work effectively or you can't produce enough of it. In both types of diabetes, because glucose can't get into your cells, it begins to build up in your blood. And too much glucose in your blood causes a lot of different problems. To begin with, it leads to diabetes symptoms like having to wee a lot, being incredibly thirsty and feeling very tired. You may also lose weight, get infections like thrush, or suffer from slow healing wounds. Over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, people can live a healthy life. And there's much less risk that someone will experience these complications.
So, as you know, we can see from the video, diabetes basically means too much sugar in the blood vessels. When we eat, especially food containing carbohydrate, they're broken down to what we call glucose, which is the smallest smallest unit of carbohydrate. This goes into the blood vessels, and then ideally it should go into the cells, the tissue, outside the blood vessels. But with diabetes, they either cannot usually they cannot get into these blood cells, and there are two types. There's the one called type 1 diabetes, which usually occurs in young people, and it tends to just occur randomly, rather than lifestyle or family history. Just tend to occur randomly. And in this type 1 diabetes, they don't produce enough insulin, because the part of the body that produces a called pancreas, the cells that would normally produce it have been the cells that will produce it have been damaged, and without insulin, the glucose cannot enter into the blood vessels. Then the second type, which is more common, is the type 2 diabetes, and this type 2 diabetes occurs in adults, usually in adults and older people, and it's often linked to our lifestyle. It can run in the family as well, and it's also linked to our lifestyle, as seen in the video. If we're inactive, we are very overweight. We eat a lot of sugar, carbohydrate. All these can increase our risk of having diabetes. And the way diabetes presents in general, the early signs will be, people may be feeling excessively thirsty and wanting to drink a lot of water. Then they may be passing lots of urine, large volume, and going quite frequently. Then they may have, it may affect the immune system, so they may have infections. They may be having frequent infections like skin infection or thrush, which is a type of yeast infection. They may be having boils, not just one boil. They keep having several boils in their body. So this could be signs, of diabetes. And if it is not detected early and treated properly to bring this level down, then it can now cause long-term damage to several parts of the body. It can increase risk of stroke, for example. It can affect the eyes. People can even lose their sight if not managed properly. It can increase risk of heart attack. It can damage our kidneys, just like high blood pressure as well. Then people can lose feeling, sensation in their hands and in their feet, and they may also begin to develop poor circulation to their legs, and ulcers, wounds that doesn't heal easily on their legs. These are things that develop much later if it is not detected at an early stage and managed properly. With high blood pressure, I can't remember if I talked about what causes high blood pressure. There are several types of high blood pressure, but the commonest is the one that there's no kind of specific cause, but we know what we call risk factors, things that people that are more likely to have it. There are particular attributes that they have that make us more likely to have high blood pressure. One, if we have history in the family, then that can increase our risk of developing high blood pressure. If, just like diabetes, if we're overweight, we eat a lot of, fatty food, food containing lots of carbohydrate and fatty food, instead of eating healthier food like greens, fruits, vegetables, and stuff like that, then that can increase our risk of having high blood pressure. Then too much salt as well can increase our risk of having high blood pressure. And inactivity. We often go to work, desk job, sit down all day, no time for exercise. This, recipe for having high blood pressure. Then it's the other thing that is also important that may cause high blood pressure is taking too much salt. Sometimes we eat too much salt. That can increase our risk of having high blood pressure as well. Yes, as I stated earlier, early diagnosis is very, very important. So that leads me to how do we actually diagnose these conditions early? Starting with high blood pressure. The reason why a high blood pressure or hypertension is called a silent killer is because most people don't have symptoms. Most people are not aware they've got high blood pressure. It sometimes doesn't give any symptoms or any warning until it causes a serious health issues like stroke. So that's why screening is very important. And in terms of screening, how often should you actually get your blood pressure checked? I'm talking about someone who is not known to have high blood pressure now. I would say it depends on a few things. We all know that the older we get, the more likely our risk of having high blood pressure. So, as this is just an advice, because we know high blood pressure is quite common. in us, we black people as well. So I would say, as a rule, uh, it's probably a good idea if we, if we are over 40, if we get our blood pressure checked at least once a year. And that means if it's normal this year, then in a year's time, make sure you get it checked again. What is actually normal? Normal, you know, means the normal range is usually between one, let's say from say one, let's say from say some people may have slightly low blood pressure, which is normal for them. So I would say from 90/60 to about 140/90. So if your blood pressure is I would say if it's less than 130/80, and you're older than 40, you know, having it checked once a year sounds about right. But if your blood pressure is if you're more than 40, and your blood pressure is, say, it's still normal, but maybe more than 130/80, maybe let's say close to 140/90, then it may be good to check it a little bit more frequently, maybe every 6 months or so. Yeah, and for those people who are younger, let's say 18 to about 40 years old, I think probably getting it checked every 2 to 3 years sounds about right, especially if the last time you checked, if the reading is below 130/80. If it's getting close to upper end of what is normal, close to 140/60, of course, over 90, of course, it's better to check it more frequently, maybe every 6 months or so. There's also a category that we call high risk, who may also be young, who may be less than 40, but with high risk factors. For example, if we know that we're very inactive, we're overweight, we have a very stressful life, or those who drink and lots of alcohol, those who smoke, those who probably they eat lots of salt. I would say it's probably a good idea to check it more frequently. The To check your blood pressure, it's actually, of course, you can see your doctor or a nurse, but it's actually not difficult. The machines are, I believe, are now readily available all over the world, and they are not too expensive. They're things that we can invest into. We should learn to invest into our health. My advice would be, if we're older than 40, at least one in the family, people should have one blood pressure machine in their family, to keep a track of their blood pressure. I think that's quite important. In terms of symptoms, a few people with high blood pressure may have symptoms, especially when the blood pressure is quite high. People may suffer from headaches. So if you are having frequent headaches, then I think it is important to get your blood pressure checked. Or sometimes it can affect the vision, the sight. So it's important to get things checked. Or some people may be more aware of their heartbeat, and that means their heartbeat is kind of pounding because the heart is pumping at a high pressure. So they may have what we call palpitations, where the heartbeat becomes quite strong, and sometimes there could be a little bit of butterflies like fluttering in the heart, in the chest, perhaps because the heart is missing one beat or two. So so it's quite important to get blood pressure checked if you're having those symptoms. But just as I said, most people don't actually have symptoms until it has caused problems. For example, if it causes heart failure, then people begin to become short of breath. If it affects the kidneys, then people can have can become poorly because of a kidney failure, because the kidney is not removing the toxins. It can make people poorly, and of course it can cause stroke as well if not detected early and treated properly. Then for those who have been diagnosed with hypertension, to diagnose hypertension, actually we don't use just one blood pressure reading, except if it's really, really very high. This is because there are a lot of things that can affect our blood pressure. It depends on, you know, our state at that point in time. If we're under a lot of stress, or maybe just we're very active running, or we have a lot of worries, all this can affect our blood pressure. So your doctor may want to do it a few times before they actually confirm that you've got high blood pressure, because it may go up and down a little bit. In fact, one of the best way to diagnose it is to actually record your own. If you have the machine, is to record your own blood pressure twice a day for a week, and then find the average. So you record it in the morning and then in the evening. Do that for 7 consecutive days. That means you get about 14 readings, and then find the average. That is more reliable. So if it is more than 140/90, then your doctor would then decide whether you need to start treatment for high blood pressure. And when the treatment has been commenced, I won't talk too much about the treatment because you really need to see your doctor, but I will talk about some changes you can make to help your blood pressure. There are things you can do, to help your blood pressure, to lower it, and lifestyle changes is very important. And one of the top on the list would be exercise. Of course, it is advised not to exercise if your blood pressure is extremely high, because it can increase your risk of having stroke. But when your blood pressure is coming down towards lower level of very getting close to normal, you can, if you become more active and you do what we call moderate exercise. That's a form of exercise that will make you sweat a little bit, like jogging, like running, swimming, cycling, being active, things like that, that can lower your blood pressure. Of course, losing weight can lower your blood pressure as well. So whatever you can do to lose weight, either diet and exercise, that will help lower your blood pressure. Cutting down your salt intake is quite important, can help lower your blood pressure as well. And of course, we know lack of sleep and too much stress, the worries of this world, it can increase our blood pressure. So anything you can do to reduce your stress level and to have good sleep will have a very positive effect on your blood pressure. But in terms of medication, I think the best thing would be to see your doctor. And some people may not need medication initially, especially if it's only borderline. With lifestyle changes, you may be able to actually bring your blood pressure down and control it. By making those changes. But in terms of medication, the best thing would be to see your doctor who will start on medication, and the interval at which your doctor will want you to have your blood pressure checked will vary. It depends on how high your blood pressure is. So you just have to follow the advice of your doctor. But one thing that is very important with in the treatment of your blood pressure is that this is not a cure; it is a control. Many people feel, oh, my blood pressure was high, and then maybe they start medication for a month or two. The measure of blood pressure comes back to normal. They assume, oh, I've been cured of high blood pressure. It doesn't work like that. You need to remain on medication. At least you need to follow the advice of your doctor. In terms of treatment, once you've started medication, most people will need medication long term to control their blood pressure. If you stop it, your blood pressure will go up again, and then those risk, factor will come in. Risk of having stroke and heart attack and kidney problems will set in. So it's very important to remain on treatment and to get your blood pressure checked more regularly, as suggested by your doctor. It's also important to, your doctor may want to do a blood test, as at the time of your diagnosis. And because of this long-term effect that the high blood pressure can have on our heart, on our kidneys and all that, your doctor may want to doctor will want to do some blood tests, maybe it could be every 6 months or annually, just to make sure that your system is working well, your kidneys are functioning well, it's not been damaged by the high blood pressure. So that means if you're already on treatment, you need to see and your blood pressure is now controlled, you still need to get help, see your doctor maybe once or twice a year, for regular tests and the monitoring of your blood pressure and the way your kidneys are functioning. There are also other treatments that are not directly related to your blood pressure that are quite important. Your doctor may want to check your cholesterol level because high cholesterol and high blood pressure, the same thing goes with diabetes. They like three, evil combinations. They all increase, our risk of having all these complications that I mentioned earlier, like stroke, heart attack, kidney problems. So sometimes your doctor may want to check your cholesterol and then put you on a medication to lower your cholesterol level. Then with diabetes, there are two tests used to diagnose diabetes, to measure how much glucose is in the blood. There's one called fasting glucose. This is the one where you fast overnight. That means when you go to bed, when you wake up in the morning, you don't eat or drink, you just go straight for a simple blood test. That means you fasted overnight, you've not eaten for at least 6 hours. This can measure how much blood glucose is in your blood. Then the second one is the one called HbA1c. This HbA1c, it's kind of more reliable because what it does is that it measures the amount of blood glucose, the average blood glucose in your blood over the past 2 to 3 months. So it gives you all the average by just one single blood test. That's much better than the fasting glucose, which kind of measure how high your blood glucose is at that point in time. So if you have access, maybe if your doctor or the laboratory closest to you has option to do HbA1c, that is the one that I would recommend you do. Then how often should we actually get this screening done? Just like I said for high blood pressure, it depends on what we call risk factor, the chances that we may develop diabetes. So I would say at the age of 40, definitely, people should go for test if they've never had it done before. Um, and then if it is normal, it's probably not unreasonable to get it done maybe every couple of years. If you can do once a year, that's fine, but perhaps every couple of years. Those who are less than 40 but with a high risk, with those high risk uh, uh, features that I mentioned earlier, like being overweight, if we have someone in the family who has diabetes, if our lifestyle involves, maybe drinking and smoking, drink a lot of alcohol, then even those who are less than 40, it may be a good idea, let's say from, perhaps age of 30 and above to just have it done once or twice, just to make sure that we don't have it. Of course, if we are having symptoms, if anyone's having those symptoms I mentioned earlier, passing a lot of urine, excessively thirsty, developing skin infections and thrush, then they need to get it done when those symptoms start. That's quite important. Then after diagnosis, then of course your doctor will determine how often you need to have this monitored. It depends on the kind of treatment your doctor uh, suggests. If, for example, those on what we call insulin, they may need to actually check their blood sugar almost on daily basis. But those who are not on the injection, the insulin, who perhaps are on some tablets like the one called metformin, they don't necessarily need to keep pricking themselves. There are machines we can those on insulin can use to check their blood own sugar every day. But those on tablet like metformin may not need that. They may just go for the HbA1c, the one that look at the average over 3 months. They may just have that done maybe every initially it could be every 3 months, but later if it's stable every 6 months, will probably be appropriate. In terms of treatment, I think with diabetes you have to see your doctor. Your doctor will decide what form of treatment is best, whether you need to be on tablet or whether you just you don't even need tablet, just need to make some changes to your lifestyle. I'll talk about lifestyle in a minute. But if you need treatment like drugs in form of tablets or insulin, then you will need to see your doctor, because it depends on how bad the diabetes is. So that's why you need to see a doctor, and your doctor will decide how often you need to be seen. Your doctor may want to make changes to your treatment as well along the line, depending on how people respond to treatment. But actually, a lot of people with diabetes may not require medication if they can make some changes to their lifestyle. For example, we know carbohydrates is what actually it's what the body breaks down into glucose in the blood, which causes this problem. So cutting down carbohydrate can really help to control the level of blood sugar. So diet is very important. The food containing a lot of carbohydrates. It doesn't mean we cannot eat it at all, but we have to cut down, especially the portions. Like our food is quite starchy, isn't it? We eat a lot of yam and cassava and stuff like that. So having a small portion of those and not all the time just eating carbohydrates will be important in managing managing diabetes. Then eating more balanced diet, more of greens. There are some fruits that may have high sugar, so we need to avoid fruits, with high sugar content. So, but things like leafy vegetables, greens, foriro, and things like that. Those will be good for diabetes. Then, as I explained earlier, that diabetes can affect many organs in the body, so like the eyes and the kidneys. It is very important. People with diabetes should get regular tests done. Yeah, it is recommended that people with diabetes should have their eyes checked by the optometrist or by the optometrist, the eye specialist, at least once a year. Because diabetes can cause cataracts, it can affect the back of the eyes as well. So it's important to get eyes checked at least once a year. Then it's also important to get blood pressure checked, because diabetes can cause high blood pressure. Then it can affect the kidneys, so it's important to get blood tests done to check the kidneys as well, perhaps once or twice a year. And most people with diabetes, may also benefit from medication for cholesterol. So, because just as I said earlier, they're like three, and they're like a arometa. So the three evils, that can increase our risk of having a lot of health problems like stroke, heart attack, kidney problems. So they can often go hand in hand, and the three may need to be treated at the same time with medication. So I don't know if I've covered everything. The take home message really that I want everyone to take home today, even if we can't, I know it's difficult to remember everything, is that, high blood pressure and diabetes, they're very common, very, very common, and they're major, killers, and they cause a lot of other health problems as well. And most people don't know that they have it until it has caused problems. And so the best way is to go for regular health checks so that it can be detected early. And when detected early, is important to make necessary changes, and if treatment is required, to stay on treatment and not just stop and say I've been cured. By that, if they are controlled, most people can live to old age, live normal life. So that will be the take home message from me. Thank you very much. I hope you've learned one or two things. God bless.